He is the program director for the San Diego County Marijuana Prevention Initiative, or MPI, who is one of our co-sponsors of this event. He is a certified prevention specialist with over 15 years working in the field in both San Diego and Los Angeles counties. He is an advisory board member for SAMHSA Region 9 Prevention Technology Transfer Center. And without further ado, Joe is going to give us an update on California.
Thank you so much, Amy. And I have to just say again, a shout out to HIDA NMI for putting this together. I know what goes into putting this together, and those meetings start months ago. So I have sort of the same disclaimer that Dr. Rodriguez had. I was sick for the last 2 weeks, and I hope I don't cough through this. So I have a lot of information I'm going to share, and we'll get right into it. So I am part of a larger prevention group that is funded through the county. I'm grateful that our county has a funded marijuana prevention initiative because it allows us to track pre and post legalization numbers. We also have a binge and underage drinking initiative, alcohol policy panel, and the San Diego County Substance Use and Overdose Prevention Task Force, which you'll hear from in the next 2 days. We also work with drug-free communities grants, school districts, regional prevention providers, SANDAG, UCSD, Rady Children's Hospital, Scripps, and the list goes on. Please, if you're doing prevention work and you have a HIDA in your region, utilize them. They are an excellent source for collaboration and data. So I just want to talk about the frustration of doing this work for a little bit. And what is the elephant in the room? And the elephant in the room is that we are always having to play by the rules while the industry can use every tool in their toolbox. They can provide misinformation. They can use their funding to contribute to campaigns. They can lobby. So there is frustration that comes from doing this prevention work, and I understand it. But one thing I will say is that our prevention work has become increasingly excellent, I think, because we've had to be at the top of our game, because we really are not playing on a level playing field with the cannabis industry. I want to talk about access to cannabis in California and some things that actually created where we are right now. And one of them that I don't want us to forget anytime soon was that marijuana was deemed an essential business during COVID. And what this did to me and other prevention people was make our job a lot harder when we spoke to kids, because the governor put the cannabis industry in the same category as hospitals and medical facilities. So it made our job a lot harder by declaring it essential business. And I'll tell you too, I saw a lot of different businesses go out of business. I've lived in San Diego for 25 years, and I just wish that some of those businesses were declared essential because they were staples that I used to go to all the time. A lot of our restaurants went out of business. I want to talk about how many counties are actually getting into the retail market. I mean, it may be surprising for people to know that 56% of cities and counties in California do not allow any type of cannabis business. 61% of cities and counties do not allow any retail cannabis business. 44% of cities and counties allow at least one type of cannabis business. We are allowed to grow 6 plants for personal use if you're over 21, and also allowed to have a certain amount of resins or that. You can see Oregon has 4 plants and Washington has 0 plants. In the city of San Diego, the city of 1.3 million people, we're allowed to have 4 cannabis businesses per 9 council districts. You can see there are 35 currently in business right now. And the city has an excellent website, and you can see where they're located. I also want to give a shout out to the city attorney, Mara Elliott, who is suing 2 local businesses who allegedly continued to sell flavored tobacco products after the state banned their distribution. It's one thing to have these laws on the books. It's another thing to enforce the law, and I applaud Mara Elliott for doing this. We are seeing some infighting amongst the cannabis industry. Licensed retailers are going after the sellers of synthesized marijuana. This is going to be a lawsuit to follow. This is particularly concerning for those who are making Delta-8 products and the legality of Delta-8. The industry is very concerned with these sellers because it's cutting into their business. Marijuana facilities in our large unincorporated area, we have 5 as of today, marijuana businesses, but we're going to get a lot more in our county. According to the Socially Equitable Cannabis Program, all of these yellow areas may one day have commercial cannabis activities, including retail, cultivation, manufacturing, distribution, micro businesses, and temporary events. We're getting our first marijuana consumption lounge in National City. It's in partnership with Sequan Tribal Development Corporation. This is a huge facility. It's 16,000 square feet. It's a 2-story complex, and you'll be able to use cannabis on premise. We have delivery services which are allowed in every jurisdictions, even jurisdictions that have no retail. And that was a lawsuit that was actually won by the marijuana industry, which said that deliveries can operate even in municipalities that have bans. One thing that isn't talked about often is the ease at which marijuana is accessible online. And I say ease because there is an app called Ease. And it's as easy as ordering a pizza. You just click that you're over 21, and then you hit delivery. And we know kids are accessing this because we have a really good study that came out in September. Almost 1 in 5 online dispensaries were required no formal age verification at any stage of the purchasing process. This is a problem, and it's definitely a problem post-COVID when deliveries started taking off, not only for marijuana, but also for alcohol deliveries. So watch those kids who are accessing substances through online means. I know that there has been some talk about legislation in California. I'm not going to be redundant, but I do want to talk about some highlighted legislation. SB 1097, which would have required cannabis products to have a mental health warning, died in committee a year ago. I'm not sure why the industry is so afraid of labels. Every industry has warnings on it. I can't go in and buy a lollipop without saying there's a risk of choking on it. So AB 1207, which was talked about, which had a wide range of support throughout California. And when I say we did excellent prevention work, this is an example. This had wide range of support throughout California. It was popular in both the state assembly and in the Senate. And I will say something with this issue. It's not going anywhere. These poisonings, unfortunately, are going to continue. As the industry celebrated online, and you can see if you Googled the day after this, they are celebrating. Here locally, we had 4 third graders hospitalized after eating edibles. I want to applaud the quick response from Escondido Union High School District, who said that the wide accessibility and commercialization of edible food products is a cause for concern for school communities throughout the state. So I know this was mentioned. One of the kids was in the hospital for quite a long time, unfortunately, but I think he's out now. AB 374, which was vetoed, which was good, would have rolled back certain protections and guidelines concerning secondhand smoke in the workplace. So that was good. I want to talk also to my prevention colleagues about cannabis prevention messaging. What can we do in 2024? And I think there's really 5 areas where we can extrapolate on prevention activities: the poisonings and packaging, the mental health and labeling, Delta-8 legality, potency caps, and whatever happened to Valley. which sounds like a new movie that would probably be a box office hit. This issue of cannabis exposure to kids is not going to go away anytime soon. And again, as I said, it's very rare that an assembly bill has the assembly and the state which favored it. And then it went to Newsom's desk and he vetoed it. So it was very rare for that. Here in the county, we are tracking poisonings. I encourage every other county to track poisonings. Since legalization in 2016, we've seen a 75% increase in poison control cases, mostly driven by edible use. So please document the exposure as we go through this, and always be honest with your healthcare provider, as Dr. Laub said, so they're not getting unnecessary testing done. It's important to document these cases because we use the data when we go in and advocate. So always call poison control to document the case. We have a youth mental health crisis, and one of the things I've been listening to intently during this is marijuana helping or hurting with this? In the past 10 years leading up to the pandemic, feelings of persistent sadness and hopelessness, as well as suicidal thoughts and behaviors, increased by about 40% among young people. And this is according to a survey we use all the time, the Youth Risk Behavior Surveillance System. We know that retail marijuana sales started in Colorado and Washington. That was about 10 years ago. When we do look at the data here locally regarding mental health and suicide, an unfortunate statistic we uncovered, according to the medical examiner, was 39% of completed suicides under the age of 25 tested positive for THC in 2020. This was higher than alcohol. This was about 1 in 3. We know the problem that Colorado is having with suicide, and I think this is a data point for everyone to track. Cannabis is a risk factor for psychosis. Not everybody who uses cannabis is going to get psychosis. Not everybody who smokes a cigarette is going to get cancer, but it's a risk factor. Things to consider: a dose response, age of use, the potency of use. People are taking cannabis-induced psychosis seriously. This case of manslaughter, which recently happened here in Ventura County, both prosecutor and defendant decided on a lesser charge after their medical expert examined her and agreed with the defense team's expert that she was suffering from cannabis-induced psychosis. Now, I'll tell you, I've been doing prevention for 16 years. If I would have ever mentioned 16 years ago about cannabis-induced psychosis, I would have been laughed out of the room. Now it's being used as a defense legally. People are taking it seriously. I always think, what if scientists actually use the products that our kids are consuming in their research? We know that we're prohibited from using the high potency products because it would be an unethical study and we wouldn't be in compliance. But if we're seeing correlations with low amounts of THC, can you imagine what 90% what our kids are using would show? Delta-8 legality, and I think the infighting in the industry is going to be very telling. I think we're going to see more decisions on whether these hemp-based synthesized chemicals are actually legal or not. And usually the best way these things are determined are through lawsuits, unfortunately. What I am going to share are some excellent info sheets about health impacts from Delta-8. I know the CDC spoke this morning. They issued a health brief about Delta-8, and also the FDA put out a great issue brief. Another thing I want to talk about is whatever happened to EVALI. In 2019, there were so many cases and everybody was concerned about it. And then all of a sudden, 2019 happened, 2020 and COVID happened. I don't know if this just disappeared, but when I speak to kids and I talk about vaping devices in general, I tell them that no research has ever been done on the health impacts of vaping. So we don't know if EVALI was a short-term consequence of using, or some of the chemicals that were used in there caused E-Valley and then it went away. But these devices went straight to the market, and we are the lab rats that will decide in 20 years what the long-term impacts are when we end up in the ER. Other facts about vaping: these products are considered hazardous waste, both the cartridge and the battery you shouldn't throw in the garbage. And for a generation that's concerned about environmental issues, don't throw them in the garbage because they end up here. You know, most of us know that there's a floating island of garbage the size of half of the United States in the Pacific, and that these vaping devices are mostly plastic. So what happened to E-Valley? Back in February 21, there were 70 deaths and over 3,000 hospitalized. Our latest count in San Diego was 64 local cases. About 95% of individuals reported vaping THC cartridges. We had one death in 2020. When I spoke with Dr. Lev recently, she said she had a case in Scripps back in July. The state stopped counting E-Valley cases in April, and the total cases were 250. There were 5 deaths related. We have a few studies about E-Valley patients and some follow-up. 12 months after their diagnosis, many E-Valley patients said they still have lingering health problems. 48% had respiratory limitations, almost 60% had anxiety or depression, 62% of patients had post-traumatic stress disorder, and almost 25% had significant shortness of breath. About 6% of the E-Valley patients caught COVID-19 during that year of follow-up, and sad to say, a year after their E-Valley diagnosis, about 35% said they were still vaping or using e-cigarettes. 20% were smoking, and 54% using marijuana. So we never got a conclusion on this. Was it the vitamin E acetate? Was it the liquid THC? Where did this go? Are we using or mixing this up with COVID? Are we not capturing this anymore? I think this is something we need to keep track of, because I personally don't think it just disappeared. And we don't know which chemical was responsible for it. Some prevention resources that I want to talk about. If you haven't heard of this group, Getting It Right from the Start, it's excellent. They have report cards on different counties in the state and their retail ordinances. Every year they come out with policy scorecards, and they're excellent. And they will look and compare different municipalities and counties on how they're actually navigating the marijuana legislation. So join their listserv, Getting It Right at phi.org. Their report card just came out in 2023. I want to also applaud our county Health and Human Services Agency for putting out some great messaging around safe storage of edibles. Please do not use in front of children. Keep in resealable bags, and please be honest with the medical staff. Even bring the package the edibles were in to the hospital, because there's a lot of other chemicals around like Delta 8 that maybe the staff need to know about, and they may treat the child differently. Rescue Agency and the California Department of Public Health released their cannabis education campaign back in January. Mind Over Marijuana. There's slides for parents and guardians as well. Rescue Agency does an excellent job here, and I think they're also national. Some great tip cards that came out from the University of California, San Diego, TREDS. For those of you that don't know, in 2021, San Diego County recorded 39 DUI fatalities. It was actually the worst year in record. In 2022, thankfully, those numbers decreased. An interesting point is that over half involve polysubstance abuse or polysubstance use. The most frequent combination was marijuana and alcohol. These tip cards are excellent because they talk about safe driving windows. When you consume marijuana by inhaling it, wait at least 4 hours to drive. When you eat an edible, wait at least 8 to 10 hours to drive. Individuals should not drive until the effects of the drug are no longer felt. These tip cards also talk about what it means to get your first DUI, that it costs about $13,000 for legal fees and to get a lawyer. UCSD is also doing an online event November 27th. It's a free virtual event. It's called The State of Cannabis, a survey of 5,000 Californians. They're doing some really interesting research, not only on driving, but patterns of use, trends, and what the effects of some of these cannabis laws are having on our California population. I'm very proud of our media work that MPI, in correlation with Rades and Sandag and HIDA, have done regarding both the edible poisonings and suicide and mental health during Suicide Awareness Month. I think our public health messaging has been stellar, and I'm very proud of us. MPI presentations, which is my initiative, we've been getting asked to do presentations for younger kids and elementary school, dealing with coping skills, and we have presentations that deal with that, and the middle schoolers, and also vaping specific presentations. Help is available. Marijuana Anonymous is active in our region, and they have a youth group. There are video resources, prevention groups. There is some harm reduction. Again, don't use in front of kids. Keep the product stored away from kids. Take account of how many gummies are in the package, so when you go back to use, you know if any are missing. And again, please be honest with the medical staff. When I heard the doctor say that lumbar punctures and radiation kids were being, subjected to, it breaks my heart when they can just admit it. And most likely from the report, they said that CPS reports wouldn't be generated on most of those people that were honest with the medical staff. Some action items. We do a lot of social media through our San Diego County-wide media advocacy. We have a greater impact when we have a united front. So we should be liking and sharing and following. Track your local data. I want to also point out that the Isaac Library is an excellent source of medical backed research. Whenever you're debating this issue, which is the reason I'm bald, I've debated this issue for so many years. Now I have the research very easy in one link to go and use whenever I need to back up whatever I'm saying. We should also have social media activity monthly calendar. We know that December is DUI Prevention Month, September is Suicide Awareness Month, October is Red Ribbon, and we should be doing our prevention activities around these specific months. We have our MPI resources, and I'm going to say that I was great on time. Any questions or comments? Here is my email. If you don't know me, I'm very easily accessible. I usually answer very quickly, unless I'm very sick like I was for the last 2 weeks, where I didn't go anywhere near my email. So I'm going to stop sharing and open it up for any questions.
Thank you, Joe. We received a question. Has there been any cannabis that has been confiscated that was adulterated with fentanyl?
I get that question a lot, and I can't say. I think there was one case that might have been substantiated up in Vista maybe 3 years ago, but I haven't heard of any large, of this issue being that broad. And I think if it was, we'd be hearing a lot more of people going to the hospital than we already do. Unfortunately, those numbers aren't great either, but I think we would see an outstanding number of people going to the hospital.
I can tell you that we at HIDA look at that extensively as well, and I second what you said. And any times that we have seen, and working with our medical examiner as well, if one is on board and if both are on board, they have been intentionally used. It wasn't adulteration. All right. Well, thank you, Joe.
Great to see you.
Thank you for your partnership. I hope you feel better soon. Stay inside because this weather isn't going to help you any.